density assessment. The bone density assessment, also known as bone densitometry, employs specialized radiography techniques to quantify the density and resilience of your skeletal structure. In most instances, the examination encompasses the vertebral column and hip, while occasionally, the forearm is included. Various scanners employ diverse methodologies, with dual-energy X-ray absorptiometry, DXA, being the most prevalent. Quantitative ultrasound, a radiation-free alternative, may also be applied. When the bones exhibit somewhat diminished thickness, the condition is referred to as osteopenia. In instances of severe bone thinning, it is classified as osteoporosis. Bone density assessments offer a meticulous determination of whether you manifest osteopenia or osteoporosis. Both genders typically initiate a decline in bone density around the age of 50. However, women often experience a swifter rate of bone loss due to hormonal fluctuations during menopause. Consequently, women are substantially more predisposed than men to develop osteopenia and osteoporosis before reaching 70 years of age. Exercise and various therapeutic interventions can mitigate and even redress bone deterioration. Hence, the diagnosis of diminished bone density bears great significance. Beyond its role in detecting osteopenia and osteoporosis, bone density testing proves invaluable in tracking your progress when undergoing bone strengthening treatments. What is the procedure for preparing for this evaluation? Ensure you promptly inform your physician if there is any possibility of pregnancy. A diagnostic test utilizing X-rays should be abstained from during pregnancy, due to its potential association with an elevated risk of congenital anomalies. What transpires during the evaluation? Bone density assessments can be conducted within the radiology department of a hospital, a radiological diagnostic facility, or a medical practitioner's clinic. You recline upon a table resembling a canopied sunbed, while a radiologist or X-ray technician maneuvers a scanner over your vertebral column, hip, or wrist. The assessment takes approximately 10 to 20 minutes. While the evaluation itself is painless, you may encounter some discomfort owing to the necessity of remaining motionless. What are the potential hazards associated with this examination? This assessment does not entail any substantial risks. X-ray-based bone density tests expose you to roughly 1/10 of the radiation dosage encountered in a solitary chest X-ray, a dosage generally deemed safe. What is the typical time frame for receiving the assessment results? Results are typically available within a few days. The results encompass two scores, the T-score and the Z-score. The T-score appraises your bone density relative to the norm for young adults of the same ethnicity and gender. The Z-score gauges your bone density in relation to individuals of your age, ethnicity, and gender. A positive T-score indicates that your bone density surpasses the average for a young adult, while a negative score implies a diminishment in bone strength. If your T-score registers between -1.0 and -2.5, you are diagnosed with osteopenia. A score lower than -2.5 signifies the presence of osteoporosis. In general, the lower your bone density, the higher your vulnerability to fractures. Hip fractures, in particular, are debilitating, while wrist and vertebral fractures are frequent and distressing. Among experts, bone density measurement at the hip and spine through DXA is universally acknowledged as the most reliable predictor of fractures attributed to reduced bone density. Fortunately, a spectrum of treatment alternatives is available. Engage in a discussion with your physician. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions. Your health matters for us. We are quali.health.